Welcome to the press briefing. On stage, we have Dr. Albert Au, Principal Medical and Health Officer, Communicable Disease Branch of Center for Health Protection, and Dr. Sarah Ho, Chief Manager from Hospital Authority. Dr. Au, please give us an update of the cases. Good afternoon, everyone. I'd like to report to you cases received or reported to the Center for Health Protection yesterday, 8th of March. Through nuclear exit tests, we confirmed 25,991 cases. Case number 525,249 to 551,239. Among these 25,991 cases confirmed by nuclear exit tests, 3,123 were confirmed by the Hospital Authority, 2,825 by Public Health Laboratory. The remaining 20,443 cases by private laboratories. Now, 7 cases among them were imported, and 25,984 local cases. The Public Health Laboratory conducted genome sequencing on 2,825 samples. No L452R, i.e. Delta variant, was found. 1,816 were negative to LR452R, meaning they were Delta cases, and for 354 cases, results are pending, and 645 samples with viral load too low for identification. Through our declaration system for individuals tested positive for COVID-19 using RAT, as of yesterday, 32,766 members of the public registered and successfully confirmed. We issued them with isolation orders already. It's worthy to note that among the 32,766 cases, around 9,700 of them had their sampling on the 6th of March. Because the platform was launched at 6 p.m. on the 7th of March only. Generally, confirmed patients will have to report to us on the same day or the next day. So for the 7th of March, the registration should be from patients confirmed on the 7th or the 8th of March. But then we included the samples done on the 6th of March to yesterday's cases. Now, for those, if we consider PCR tests, and so far we have 534,602, and through RAT, 34,784. Yesterday, another 27 care homes had outbreaks or cases. 20 of them were elderly care homes, 7 homes for the disabled, involving 370 cases. Among them, 278 were residents and 92 staff members. In total, in the 5th wave, we have got 710 elderly care homes with outbreak or cases. And in these 710 elderly care homes, in the past 2 weeks, there were 450, accounting for 56% of all the elderly care homes in Hong Kong. In the 5th wave, we have a total of 19,600 cases involving residents, accounting for about 26% of the population living in elderly care homes. Now, for staff members, 5,310 cases, accounting for about 18% of all the workers in elderly care homes. And as for RCHDs, so far 237 homes for the disabled have got outbreak or cases. Among the 237 cases, 179 of them were recorded in the past 2 weeks. accounting for around 53% of all the homes for persons with disability in Hong Kong. In the fifth wave, we have around 5,420 cases involving homes with for persons for the disabled, accounting for 30% of the total number in Hong Kong, and for staff members, 230, accounting for 20% of all the workers in RCHDs. And deaths involving residents, we have at least 1,408. 1,405 were residents. 1,405 were residents in elderly care homes and 3 in RCHDs. Although 70 to 80% of our care homes have got cases already, residents and workers affected are around 20 to 30% respectively. That means many residents and workers are not yet infected in this wave. So it's urgent to inoculate residents and workers as far as possible to protect them from infection in this wave. About half of the cases, about half of these homes had cases more than 2 weeks ago. That means there are probably no more cases in these homes now, and so those not vaccinated should do so as soon as possible. The number of deaths in the fifth wave, we have got 2,656 death cases, up 291 compared with yesterday. The death rate is about 0.46%. Aged range 11 months to 108 years, and the median age 85 years. Those over young 5 and then age between 18 and 59, 127, accounting for 0.78%. Most of the cases involve those over 60 years old, a total of 2,518 cases, accounting for 94.8% of all the cases. In a new death case today, is reported by the MOR of the Department of Health. It involves a 76-year-old female with chronic illness. On the 7th of March, she was found dead. Among the latest death cases, analysis of states of vaccination, most of them, or 90.7% of the death cases, were not fully vaccinated or not vaccinated at all. Those who are above 80, among the death cases, 92.7% of them were either not vaccinated or not fully vaccinated. Overall speaking, the death rate for those who have been fully vaccinated was 0.06%. For those not fully vaccinated, 1.64%. So there is a difference of 27 times. For elderly persons over 60 years old, those who have completed 2 doses of vaccines, the death rate is 2.27%. Compared with their counterpart that were not vaccinated or not fully vaccinated, over 80 years old, the death rate is 10.87%, a difference of 5 times. That's all from me. Thank you. Dr. Ho.
Good afternoon. At present, 8,883 confirmed or preliminarily confirmed patients are under treatment in our public hospitals, the North Lantau Infection Control Center and the HA's Infection Control Center, as well as the AWE Community Treatment Center. Last night, we have reported 68 critical patients. 107 patients are in serious condition. 68 patients who are critical. They are staying in the ICU. As at 0 hours today, in the past 24 hours, 195 patients who tested positive with COVID have passed away. They were 126 males and 69 females, aged between 41 years old and 105 years old. Among them, 98 patients were from care homes. 145 did not have vaccination record. 30 were given one jab. 19 were given 2 doses, and 1 has been vaccinated with 3 doses. 178 patients were elderly people above the age of 65. There were several relatively younger diseased patients. First, a 41-year-old female. She fainted at home. Upon hospitalization, she was found with a hemorrhage in her cerebral hemorrhage, and she was tested positive with COVID as well. The second patient, a 45-year-old female. She had cancer, and the cancer has metastasized. And also 8 patients were between the age of 50 and 56. They had cancer or epilepsy, or were staying at care homes which require long-term care. Because of delay, we have to report some additional cases. Between the 27th of February and the 7th of March, 95 patients have passed away, which we have not reported. Among them were 59 males and 36 females, aged between 47 and 100 years. For the past day, 807 patients have recovered and been discharged. Some 70 patients were found to be positive on screening, and 90 patients in the same ward were listed as close contacts. For staff so far, 11,569 staff members are confirmed. Among them, 3,425 have returned to their jobs. This morning, as mentioned in the press release, the Queen Elizabeth Hospital is converted as a designated hospital to receive COVID patients. As of this morning, most of the suitable most suitable patients have been transferred or discharged. Among them, 380 patients were discharged. 200 patients were transferred to other hospitals, and some 100 patients were discharged. Besides the Kowloon Central cluster, other clusters will begin accepting patients. It is expected that the transfer will be completed within 3 days. Now, for A&ED, there will be a special arrangement. Ambulances will only take critical patients or urgent patients to Queen Elizabeth Hospital. For patients with less urgent condition, they would be transferred to other hospitals. For patients with trauma, they would be treated at the Prince of Wales Hospital and Queen Mary Hospital and TMH. Now, on the 10th, Queen Elizabeth Hospital will become a designated hospital to take COVID patients. There will be 1,500 beds. All will be occupied by COVID patients. After designated the Queen Elizabeth Hospital as a designated hospital, we can focus patients, experts, resources, and treatments for COVID patients. In terms of patients, COVID patients from different specialist branches will be treated at the Queen Elizabeth Hospital. For experts, we can bring together experienced staff to treat patients with serious conditions. Thirdly, focusing resources in terms of ICU, manpower, and so on to treat patients with serious conditions. Fourth, focusing on treating patients with danger of life, and then during the time, the service at Queen Elizabeth Hospital will be disrupted, and we hope other patients can understand this. Our goal is to reduce the number of serious cases and fatality. For the Eden Hotel and nearby, rooms are reserved for our staff so that they can focus on treating the patients. Now, we will take questions. Please identify your media organization before you ask your questions. The gentleman over there. Good afternoon. I'm from Hong Kong 01. Now, about the figure. Today, we have 25,991 PCR confirmed cases and 32,766 RAT confirmation. Now, altogether, we have 58,757 cases. Is that correct? Compared with the level 2 days ago or yesterday, some 20,000 or 30,000, is it true that the figure was misleading because you didn't count the RAT tests? Today, counting the RAT tests, we have some 60,000, so the situation is very serious. Today, a 91-year-old and a 98-year-old elderly people have passed away at home after testing positive. Do we have a lot of such cases where elderly people testing positive have passed away at home? Is it because appropriate treatments were not provided to them? And previously, a medical supervisor at the front line told us that only 5,000 or to 6,000 packs were issued to confirm patients at home. So 80% of patients at home were not given support. So has the situation improved? We were also told that we lack a platform within the HA to coordinate the efforts. It seems that the management is not showing enough care about the frontline staff situation. Is that true? Today's number includes two numbers. First, a PCR test at 25,991 and a RAT 32,766. For the RAT number, we only have this number since yesterday. For the total number today, that is, you have to add the two numbers together, some 50,000. After rolling out the online platform, we hope that we can more comprehensively grasp the actual number of positive cases in the community. The platform will help us to collate the positive number from RAT. Now, the number today from RAT is some 32,000. The platform only started running some around 6 o'clock yesterday. When the platform is running smoothly, we will be able to report to you the number of cases which we have confirmed and have issued isolation order in the past 24 hours. The number will reflect the cases with sampling which were sampled 2 days ago. We hope that RAT positive patients can make use of the platform and report to us ASAP within 1 or 2 days. And then the figure will be able to reflect how many cases are actually tested positive by RAT. Then we will include the RAT positive number in our total number, which will reflect the actual situation. Before we had this platform on the 26th of February, we said that RAT positive cases will be treated as confirmed cases. Between 26th and February and the 5th of March, patients who were tested positive on RAT can report to us through the platform before the 24th of March. After collating the statistics, we will be able to determine how many people were tested positive on RAT each day. We will announce the figure later. By combining the two figures, we will be able to tell the actual trend since late February.
What about treatment? Dr. Ho? Now, HA has in fact enhanced the support for patients in the community. For high-risk groups, we will pay particular attention to them to lower the risk of deterioration of their condition. This will help us to implement a triage and tiering arrangements so that patients with more serious conditions can be treated first. There are a few groups considered high risk. Elderly aged 70 or above, those are children below 5 years old, and 3, women who are at 28 or more weeks of pregnancy, and patients with immunocompromised system, those who have received organ transplant, or those with immunocompromised diseases, or those who are taking drugs that reduce their immunoresponses. All these will be a core priority in receiving our support and treatment. Now, our services include the following. First, they can make an appointment with our designated clinics. Even though the slots for the day are full, then they can make arrangement to take drugs or to get drugs from these clinics to relieve their symptoms. And we have also updated our clinical instructions. So patients will be given oral drugs for COVID-19, and our nursing staff will check the confirmed patient list and will take the initiative to contact patients with higher risks, as I mentioned, and will provide them with the relevant information and support. If need be, we'll encourage patients to seek treatment at our designated clinics. We've also got a hotline. The number is 1-836-115. So if after our frontline staff have given them support, and if need be, teleconsultation can be granted. And this hotline has got 100 lines for patients to make inquiries. We'll also have an isolation care monitoring system. Hopefully, it can be launched shortly. We will have a new online platform to support confirmed patients. The confirmed patients will receive an SMS with a link to register and report serious symptoms. The system will then provide health advice and related information. There will also be a channel for confirmed patients to report their RAT results. However, the system is under construction, and once it is established, we will announce to the public. And residential care homes for the elderly, our HA community geriatric assessment teams have stepped up the support, including outreach and teleconsultation services, through which we hope to support RCHE's arrangements for patients requiring urgent medical attention for hospital admission as appropriate. We also provide clinical guidelines, and doctors will also prescribe COVID-19 oral drugs where necessary. For those with relatively serious conditions, they will be sent to the hospital for treatment. For patients with mild symptoms, we advise them to maintain to observe their own condition. For instance, if they have persistent fever over 38.5 degrees Celsius for more than 2 days despite taking fever-reducing medicine, a body temperature of 35 degrees Celsius or below, convulsion, shortness of breath, chest or abdomen pain, dizziness or confusion, weakness or unsteadiness, decreased movement of the fetus for pregnant women, or persistent inability to drink or eat, and vomiting persistently. Now they are suggested to attend an A&E department for treatment. These measures hopefully can enhance our support to confirmed patients and the community. Thank you. Next. The gentleman in gray. Good afternoon. I'm from TVB. Now, I'd like to ask about the declaration system for RAT positive. The government is now conducting on a random basis PCR tests on these patients. And according to Dr. Au, because the platform was only launched a couple of days ago, so there might be backlog of cases. I'd like to know how soon can you clear the backlog. And Professor Yuen Kwok Yung said that in the community, 1 out of 20 persons may already be infected. Have you considered whether his estimate is about right? Now, to enhance the vaccination rate of care homes, as said by Dr. Au, some of the care homes may not have new cases now, and what measures will be taken to boost their vaccination rate? And we suggested that perhaps a high level of or a healthcare staff of high level of PPE can help to vaccinate residents where in care homes where there are already outbreaks. Can that be considered? Now, QEH will be a designated COVID hospital. What patients will be given priority in admission to this hospital? Because as said by Dr. Ho, there will be more focused care for patients there. Thank you. Now for the data uploaded to the declaration system, in fact, there is no backlog. In fact, through the declaration system, we can grasp the number of infections more quickly, because it is specified that patients will have to report their RAT positive results to us within 2 days, and then an SMS will be sent to them afterwards. According to our IT staff, usually people can receive an SMS within a few minutes after registration. Then they need to upload their ID and RAT positive image, and then an isolation order will be issued and quarantine orders for their family contacts, and that would be included in our statistics of confirmed patients. For instance, I announced that we had 32,766 RAT tests positive cases. They were reported and verified yesterday, so there was no question of a backlog or time lag. We have more today because we have taken into account cases reported on or tested positive on the 6th of March. This is because we launched the platform in the evening or at 6 p.m. on the 7th. So those who are in the system should be reported either on the 6th or the 7th. So the statistics should have been included in the for the dates 6th and the 7th of March. But then, since the platform was only launched on the 7th of March, I believe that many people tested positive on the 7th were not able to report their cases within a few hours, and they could do so on the 8th. So some of the figures might have included cases tested positive on the 6th. They should have appeared on the statistics yesterday. Yesterday there was only 2,000 odd cases, and because some of the cases tested positive for 6 were included on the 7th, but that would not happen again because figures received today will be those tested positive yesterday and today and more accurate.
About random testing, since we launched the new platform, for the first time, members of the public can submit their results to the CHP. Previously, positive test results would be reported to us via doctors and private laboratories. Identity confirmation was performed. Now we are accepting voluntary reporting of results from the public. So we want to perform a random confirmation on their RAT test with a PCR test. Normally, among the RAT positive cases we receive each day, we would select a number of samples and arrange for the contractors to dispatch or deliver a testing pack to the patient. The contractor would tell the patients that they were assigned by the CHP, and then a nose swab sample collection kit would be left at their door. The patients have to fill in their personal data, and then they will collect a nose swab sample at home themselves, and then they will leave the package outside the door, and then within 20 minutes the contractor would collect the samples and deliver them to the public service laboratory. The patients selected would be from the reported cases of the same day or the day before. And then the next day, the contractor would deliver the test kit. If the RAT test results is accurate, then the PCR test should also be positive. We will compare the results. If we found any negative PCR test samples, we will conduct an investigation to check how the patient took his sample. Since there is a RAT positive result, we consider the patients to be at risky. We will arrange them to check into a community isolation center for further tests. The last question was about the number of infection. In the 5th wave, the accumulated number is more than 500,000. Many patients showed mild symptoms, especially for Omicron patients, or even no symptoms at all. We believe that some infected patients have not performed a test. So the actual number would be higher than the number we gathered from PCR and RAT. According to study, for each confirmed case, there would be 2 to 3 undetected or asymptomatic cases. So the actual number infected during the 5th wave in Hong Kong is definitely higher than the number we have. We have to perform an analysis to see the actual number. For appropriate patients, they would be taken into designated hospitals, and not just patients from the Kowloon Central cluster. The HA is converting wards into COVID wards to boost our capacity. We are going to convert as many as 50% of our beds to take COVID patients. The North Lantau Hospital and the Tin Shui Wai Hospital have been converted to designated hospital, and now we are going to have the Queen Elizabeth Hospital. Coming up, we will have a Rottenji Hospital, the Havens of Hope Hospital, and another hospital, which will be converted. Next question. The lady over there. Hi, I'm from Now TV. Now the RAT declaration platform. Will you add a questions asking whether the patients have recovered, whether they have negative results? For patients who were confirmed, they need to fill in they need to report on the platform. And also, will you ask questions about what brand of RAT they used? There is worry that RAT would return false positive tests. So would you add this question? Some patients have waited for the better half of a day before they receive the SMS. But just now, Dr. Au said the SMS would be sent in minutes. So does the time depends on the number of cases reported, and also is the platform under a lot of stress? And also, when would the isolation order be issued? We heard that someone staying in the Qingyi isolation facility has not received isolation order. And also, at some isolation facilities, there are no medical staff at present. So for each isolation facility, how many medical staff members would be assigned? And a question for the HA. 195 patients have passed away. Is it true that most of them were critical patients, or did some of the patients have their situation deteriorated quickly? And the 41 female who had cerebral hemorrhage and the 45-year-old female who had cancer, how long did they wait before they were taken in? Was the situation already bad before the ambulance came? And did they tell the ambulance man they were tested positive, or were they found positive at admission? Thank you for your questions about the RAT platform. So for those who have tried, you would know that a series of questions will be asked, including the personal information, the address, the occupation, the work address, and symptoms and high-risk factors, and so on. And also the personal data of a household contacts, so that we can issue an isolation order or quarantine order. We also ask for information about their symptoms for investigation and analysis. The platform is for patients who have just tested positive. We do not intend to have recovered patients to report to us on the platform. For patients who were tested positive before the 26th of February, they don't have to report to us since they have recovered. And we did not account RAT positive cases as in the number. So the point is to gauge the number of patients testing positive on RAT each day. On the 26th of February, we announced accepting RAT results as positive cases. So between the 26th of February and early March, patients who have tested positive on RAT should report to us. Majority of them might have recovered. We will just issue the relative certificates to them without any other actions. For false positive results, basically RAT is a very is an accurate method. Patients who get the results with reputable brands should be very accurate. The confirmatory test is for preventing incorrect results because of various reasons. That's why we have this mechanism for patients reporting positive results. We would perform a random test to confirm the RAT results.
Your third question was about community isolation facilities. Now, if person is tested positive and confirmed, we will issue an isolation order. Now, if it is through RAT, then after reporting to us, the confirmed patient will receive an SMS at once from us. And as for PCR tests, once we have registered the information, it will be passed to the Security Bureau, which will arrange for placement in a CIF as soon as possible, and an isolation order will be issued. And as for RTD exercises, persons tested positive at RDT will be given an isolation order and placed to a CIF. Those who are in CIF, well, we have different tiers and different types of facilities. Those who are in CIF are those who require isolation facilities instead of critical or serious cases that need medical care. So we have a medical post operated by HA at CIF. If necessary, we can render assistance to those who need it. And a reporter asked, now among the 195 patients that have passed away, were they all critical cases? Because there were over 100 cases. So there was a spectrum, a range. It's not that all were admitted when they were at a very serious conditions. Some only presented with fever and condition continued to deteriorate, and some of them were in critical conditions when they were admitted. You asked about the female patient, aged 41. She was a foreign domestic helper. Her employer saw her fainted in the kitchen, and she was sent to the A&E department very quickly by ambulance. She had several hemorrhage, and then we applied an RAT test, and she was tested positive. So as said, the case might not have died of COVID. The case might have other conditions, but at the same time is also infected with COVID. So this is whether we patients die of COVID or die with COVID. Another case is a 65-year-old female. She has a cancer that has metastasized, and her family members knew of her condition for a few days. English question.
I'm from Bloomberg News. My first question is for Dr. Hall. Can you further clarify whether antiviral pills such as molnupiravir and maybe later Paxlovid is automatically prescribed for high-risk groups such as elderly, children or pregnant women, especially in the community monitoring centers that you mentioned? And also, has there been any monoclonal antibody treatments used in Hong Kong for, I guess, serious and critical COVID cases? And my second question is about the proposed closed-loop management of elderly or elderly care homes. Can you maybe further describe how that will work? Thank you.
For a designated clinic, we are planning to prescribe the oral antiviral drug, but now it's still under deliberation because we are formulating the guidelines and indications. So we will update you once available. So we are still updating the guidelines. And for the before we have some serum, convalescent serum prescription, and at the moment we have also stocked up a number of antiviral medications and previously announced, and also we stockpile some oral medication already, and then another type will be delivered next week. So we are still reviewing international guidelines to indicate the prescriptions.
For the management of cases or outbreaks in residential care institutions, the government, including the Social Welfare Department, is planning some enhancement measures to prevent further outbreaks or cases occurring in residential care institutions, because the elderly or the residents living in institutions, they are of high risk, and if they get infected, the chance of having complication of fatal cases will be very high, and the vaccination coverage among the residents and staff is not satisfactory. So there are multi-pronged approach to manage to prevent outbreaks in residential care institutions. The first of all is to and increase the vaccination coverage as soon as possible for all the residential care institutions in Hong Kong. And the government has announced some measures to rapidly increase the vaccination coverage. And secondly, for the closed loop management, the whole idea is to prevent further outbreaks in the residential care institutions. As I have mentioned before, although over about 70 to 80%, or even over 80% of the residential care institutions had encountered COVID-19 cases or outbreaks in the fifth wave. But however, some of the outbreaks or homes, they are clean now, so-called clean, because the outbreak has been over, or the cases or the affected residents has recovered. But in these residential care institutions, many of the residents or staff, they had not been infected, so they are at risk. So the whole idea is to have a closed loop management so as to prevent further introduction of cases into these clean residential care homes. And I think the government will announce the details in due course.
下一題，問多條英文問題。
SCMP. Research from HKU found that the pandemic has already peaked on March 4th, and the number of daily cases will drop to fewer than 1,000 by April 23rd. What's the government's internal assessment to the research, and did the government agree with the findings? On QE Hospital, as there are more than 2,000 hospital beds in QE, and it was announced that 1,500 beds will be converted to treating COVID patients. What about the remaining 500 beds? For other public hospitals that will be considered to be converted, how many beds will be provided for COVID patients respectively? And for those who are in severe and critical conditions, how many of them are unvaccinated? Thank you.
For the first question on the epidemic situation, according to the figures on PCR tests, the daily number of cases had peaked around several days ago, up to a level of over 50,000 cases per day, and then the daily number has dropped to around 30,000 cases per day, and in the past 2 days there are around 25,000 to 30,000 cases per day. But however, the the number of rapid antigen tests has not been counted into the cases previously. So for today, we have over 50,000 cases, including the rapid antigen test. So we need to monitor closely for a few days to observe the real trend, including the rapid antigen test. But however, purely judging from the number of PCR tests, we think that the increasing trend of cases in Hong Kong has been stabilized and has reached a plateau level. But whether for the future trend, we still need to observe for a few days or up to 1 week to see whether we have already reached the peak or not.
The questions are why there will be only 1,500 beds available after QH changed to a designated hospital, because we still reserve some bed for those patients need to be stay in QEH. For example, those cancer patients and pediatric ICU or neonatal ICU patients that still need to be stay in Queen Elizabeth Hospital. And at the same time, because of the spacing and infection control, we also need to have enough spacing to ensure the infection control standard. So that's why it's not possible to make 2,000 beds completely convert to bed to take up the COVID positive patients. And in total, we wish to convert up to 9,000 beds in phases. And we are going to convert also, besides North Lantau Island Hospital and also the Tin Shui Wai Hospital, after Queen Elizabeth, we will also have Rotunji Hospital, Haven of Hope, and also from Yilgeng Hospital to convert to designated hospital. And I don't have the vaccination status of those critical patients.
下一題，黃色衫呢位。
Good afternoon. I'm from Point News. 2 questions. According to the latest information of the government will strive to complete the vaccination for 1,000 RCHEs before late March. So what is the progress now? In the past 1 or 2 weeks, how many residents in RCHE were vaccinated? Did you encounter any problems? And what about private hospitals' help? How many patients or COVID patients were taken up by private hospitals? Allow me to answer in Cantonese. On RCHEs and RCHDs vaccination, the government attaches top priority to the operation. Residents in RCHDs and RCHEs are groups with highest risk. If you look at the fatality cases and cases with severe conditions, most of them are elderly people staying in care homes, especially those above the age of 80. So the pressing task is arrange a vaccination for residents and staff members in care homes. The government has streamlined the procedures for obtaining consent. That has been implemented for some time. And outreach teams comprising medical staff from HA and the CHP and the Department of Health were sent to vaccinate residents in care homes. We are also cooperating with private institutions and private doctors to provide vaccination service for residents and staff members in RCHEs and RCHDs for their own protection. Now, the Chinese University Hospital has taken in more than 8 COVID-19 patients aged between 61 and 86. As of yesterday, the private sector has provided a total of 263 beds. 94 patients have been transferred to the private hospitals. The lady in white. Good afternoon, doctors. Ming Pao Daily. Now, all the public hospitals, AWE and designated hospitals altogether, how many beds in total are available for COVID patients? Now, by converting wards, QE, as well as the makeshift hospital in Lok Ma Chau, by how much can we increase the number of beds for COVID patients? And Dr. Au, if someone reports false information to the RAT platform, what will be the punishment? You said there would be random checks. There may be false positive results. However, it may be caused by a substandard test kits. So will the public has to be responsible for that? Now, you said patients are tested positive on RAT between 26th of February and the 5th of March. So how many people have reported the positive results between these days? And what about the latest vaccination rate for care homes? And last question, yesterday a 34-year-old male with thyroid disease passed away yesterday. On the 4th of March, he was tested positive, and the next day he was tested negative. And on the 8th of March, in the small hours, he vomited at home, and he was sent to A&ED and was found to be dead upon arrival at hospital, and he was found to be positive. So what is your view on this? First, about reporting false information on a platform. If we have suspicion, we would refer the case to the police. That would be a crime. That would be an offense of using a computer dishonestly. So for cases which we have confirmed the identity, we would treat them as a confirmed cases. We would check the photograph of their IDs and their RAT results. And we will also perform a random test, that's PCR test on some cases. Normally, after testing positive with RAT 1 or 2 days ago, the PCR test should also be positive. If we have any negative PCR test results, we would try to find out the reason. Is it because of inappropriate sampling on the patient's behalf? We will try to find it out. If we found someone reporting false information to us, we will take legal actions. And also for patients tested positive on RAT and negative on PCR, we will arrange further tests for them. To see if it is really a false positive case or is it caused by other reasons. They will be arranged to check into community isolation facility for test. The other question about those tested positive on between the 26th of February and the 5th of March, we would ask those patients to report to us. We want to gauge the actual number of community infections during that period. We believe that most of them have recovered, so no follow-up actions will be required. And we don't require immediate reporting. They can report to us anytime before the 14th of March. And after collating the figures, we will make an announcement. At present, we do not have a figure because many patients have not reported yet. After the 14th of March, we will have a figure of patients tested positive during that period. And then after collating the information, we will make an announcement. The number that I give you today or tomorrow will not be the true figure. It may be even misleading. So after the reporting period, we will definitely update you with the number to see what the trend was. Just like you asked, did our situation peak in early March? Well, we can see the actual scenario since late February by combining the RAT figures and PCR figures.
嗰個接種率我手頭上冇資料。
整體個大方向咧就係其實我哋都希望咧有50%左右嘅病床咧係會改裝接收新型冠狀病毒病。
The overall direction is we hope that we can have about half of our beds converted to COVID patients. As for the Lok Ma Chau Loop Hospital is still under construction, so I don't have any information. As regards the man who passed away and aged 34 because his condition developed very rapidly. So we have referred his case to the coroner's court for an inquiry. The last question, the gentleman. I'm AM 730. Now, Dr. Al only gave us the case number for PCR tested positive. What about those tested positive by RAT? Now we have 50,000 odd cases. Have you included the RAT positive cases? That is something to do with the case number. Now you told us that a person tested PCR negative would be sent to CIF regardless. Would that increase would that expose him to the risk of infection? And I'd like to know the number of random sampling you will do every day. The vaccine pass has started for 2 weeks. There were cases who waited at home for 14 days until they recovered. So I'd like to know the progress of the issuance of recovery certification. Is it that after they've recovered, they will have to attend a clinic to get a documentation? Now, about 2 to 30 cases were tested positive in the few blocks in Shentien Estate. Is it the same situation as that of Kaiching Estate? For RAT positive cases, they will be considered confirmed cases. So we have more than 50,000 positive cases today. In the fifth wave, PCR tested cases, we have 5,000, 38,000 odd cases. Now today and yesterday we have got 34,789 cases tested positive by RAT. So in total there are 573,386 cases. Now for case numbers, we have two different systems because we have to make a distinction between PCR positive and RAT positive cases. The latter has got a separate case number system. Recovery certification. Because there are so many cases, many positive cases could not be sent to hospital or CIF, so they recovered while staying home. The Department of Health will later issue a certificate to them to prove that they were once infected with COVID-19. Because they were never admitted to a medical facility, they will not have any certificates. But later on, we'll arrange for certification or documentation to be issued to these recovered patients. If we have details, we'll announce as soon as possible. Speaker is off mic. Yes. Every night we have RTD exercises through our sewage surveillance program. Now, if the percentage of positive samples are very high, then we'll carry out RTD. Sometimes about 50% of the residents could be found positive. That means there are numerous cases in the building, and we hope that after an RTD, all confirmed cases will be sent to CIF as soon as possible. Upon completion of RTD, such arrangement or such an order will be made as soon as possible or at once, so that these cases can be evacuated from the building and remove the risks for the remaining residents. Speaker was off mic. Generally speaking, if members of the public use reliable RAT kits, the accuracy is very high. So for an RAT positive result, we would trust that it is a positive case. The purpose of random sampling is to see whether there was any false reports. If by PCR test the result is negative, there can be various reasons. Perhaps the sample was not properly taken. So we will do a further test and conduct some investigation to see, for instance, the brand of RCT used and how the sample was taken, to ascertain whether that is a genuine case, and we'll always also arrange for him to go to an CIF. There will be a range of infection control measures, but if a case is already RAT positive, then it's a genuine positive case. The PB ends here. Thank you very much.